Last week, so a week ago, Monday, we were notified by the camp, who we've been partnering with for, since last fall, about how to safely reopen camp this summer. They notified us that they had a camp counselor who was ill, so with symptoms of COVID. So we decided to test that individual. And after testing him and his test came back positive, well, I better say that back again. After testing them, because I don't want to identify them. So after testing them, the result was positive, and we decided then to test a few more individual camp counselors. Again, when you have a known exposure, you're most likely going to find a few more positives, and we did. So then the camp worked with their board and with us at the health department, and they came to the conclusion that it would be best to cancel camp for the current week. They're following the best practices. At the very forefront of their thought process is camper safety, as well as staff safety. So they've had a few more people test positive, but by the end of this week, most of them will have been 10 days in isolation. So I know their board is working diligently trying to figure out what to do with the remaining part of the summer. And again, they've been very good to work with. They're very gracious. Again, camper safety is always at the forefront of their mind with every decision that they're making.
Yeah, tell me about that discussion of, again, everything that you can about the virus and how it works and the exposures, and you've been through all this with the last year, right? How did you help come to that conclusion that, it's best to just kind of take a week off?
Right. Well, they belong to a camping association, a national association that has put out best practices along with the CDC. There's some guidelines about best practices for overnight camps. And, they've been doing diligent work with masking, with separating, but we know just across the nation, across Iowa, people who are not vaccinated, there is an uptick in those COVID cases. And a number of their staff are not vaccinated, and that's a personal choice. So they're doing the best that they can to use all of the public health mitigation strategies that they can to protect the campers. It's just, don't know where this came from. Could have come when they were at home. Could have been an asymptomatic camper who came to camp, and now you've got some unvaccinated staff who are sick.
Yeah, is it becoming harder and harder to do that contact tracing?
It is hard to do contact tracing currently. People are not as willing to share who their contacts are. The perfect thing in this example is we have lists of campers. We have the list of the staff people, so we know exactly who's been exposed. If it happened to be a counselor who slept in a cabin, then we know who's in that cabin. So this particular case has been fairly easy for contact tracing, and the camp has done yeoman's work contacting all of the campers who were there and had a known exposure.
Anything else just about, again, you've been advising a variety of businesses and camps and back to school stuff. Just what's it like to, the virus is still out there, right? And can you kind of speak to that?
Yeah. Our best mitigation strategy to combat this virus and to slow down the transmission is for people to get vaccinated. That is the number one strategy that we need more people to get vaccinated. And vaccine is available in multiple places across the state. So that's our best strategy. And when we can't have that, then, masking, washing your hands, distancing, social distancing are the next level that we really need people to continue to practice. And I know it's hard. And again, we're seeing a lot of this virus now in the unvaccinated population. There are some breakthrough cases, but primarily it's in the unvaccinated population. So we really need to get the message out that they need to get their vaccine as soon as possible.
Do you have a count of how many people had the virus, had tested positive?
At the camp?
Yeah.
I would prefer if the camp gave their numbers.
Okay, no worries.
Yeah.
And then did you guys do all the testing?
We did all the testing. We also then at the beginning of the camping season have made vaccine available to the camp counselors. So maybe if they came from a state where it was maybe harder to access, we did do vaccine clinics at the camp and had a number of their staff who participated in that. So.
Yeah, so you've given dozens of opportunities, right? And the testing, that's great. Yeah.
Yeah.
But are you finding that the testing is down? From community members in general?
Oh, definitely. Here at Hamilton County Health Department, we did testing through the fall and the winter. Dramatically dropped off, and actually we get very few calls for people who want testing anymore. And we do have access to the Test Iowa kits, so we also can offer those to people who may want them.
Mm-hmm. Yeah, but if that individual hadn't been symptomatic, who would have known, right?
Very true. And that's why this is such a tricky virus.